Ever wonder what motivates people to get plastic surgery? Did they regret it? What can we learn from the stories of plastic surgery patients? We're here to explore the questions and get some answers today with my guest Chandra Maben on the Plastic Surgeon Podcast. Welcome back, and thanks to our listeners for the amazing feedback and responses we've gotten. It's been amazing. We're going to listen to real plastic surgery stories of triumph and pain from real patients and providers to further understand the motivations of why they would risk their life under the knife. I'm Dr.Sajan. Today I have an amazing patient for you. She's going to discuss her journey of breast augmentation. She did her surgery with us about 2 years ago, and I'm really excited to hear her journey. Chandra, how's it going?
It's good.
So we met about 2 years ago, right?
Yeah.
And you were thinking about getting a breast augmentation at that time.
Yes.
So how did you decide to come to me for surgery?
I had been to, I think, 4 other surgeons prior to coming to you. I just really wanted to do my due diligence and making sure I was comfortable.
Mm-hmm. And why were you thinking of getting breast augmentation?
I have wanted them done since I could look up surgeons in a phone book. So I've just always have wanted to have that. And then after having my son and then aging, it was time.
When you say you've always wanted them done, a lot of women will often say that. Sometimes that comes from a particular spot. Someone pointed something out or they saw something. What gave you that urge?
I don't really think that there was ever a time where somebody pointed anything out. I came from a family that was all large busted, and I was the one who wasn't. And I just, in my mind, that's what I was supposed to look like.
And you had a few consults.
Yes.
When you were having these consults, what were you thinking about as far as what's important to you?
I wanted to be larger, for one. I guess I didn't want a lift with them. And a lot of those surgeons were saying I needed a lift. And so I was trying to navigate that to see if there was any options for not having that done. And then I was getting ready. I had just moved out of family's house and it was just time.
Some people, when they say they want to get larger, some women will say, I'm doing this because I want to be more noticed. I want to feel more feminine. I want clothes to fit. I know you told me that you were wanting this because you saw this in your family. Tell me more. Is one of those reasons that I said, is that something that stood out to you?
I wanted to fit my body. I feel like I have bigger hips and a really small upper body. And so I wanted to balance that out. And then if I was going to do surgery, I didn't want to do it twice. And I did an extensive research, and everyone had been saying like they wish they gone bigger or they never regretted going bigger.
Makes sense. The journey of getting consults, how did you decide which doctors to go see?
I was on a Facebook group called Bust Mob. And so you could search your area. So I saw real people's results on there. And then I went on, there was another website.
Sure. Something with reviews.
Yeah. It was like real people posting about their experience, and they would post pictures of their before and afters and just talking to people who I knew personally. And I had a friend who worked at a Bellevue surgeon who I did her hair. So I went to him. I had another person at another Bellevue one. So people I knew personally, and then the experience of searching their before and after pictures.
Got it. And when you came to me, we talked about gummy bear breast augmentation, and that's what we ended up doing, and we'll talk about that. But before we got there, you saw the other people before me, right?
Yes.
Tell me a little bit about what they were recommending.
Each one recommended something different, which was unsettling. The first person I met with, I realized he didn't have any hospital privileges or any I think he was just I'm not sure which one's which, the cosmetic surgeon or plastic surgeon.
Sure.
Whatever one was like the lower. He was that, and that he just was like, oh, we'll just do this and we'll put this in there, and just so nonchalant about everything. And he didn't really have a plan. So that kind of scared me a bit.
Did he do sizing with you and help you figure out what size?
Yeah, kind of. He did the implants in the bra.
Got it.
And didn't do any measuring, didn't do anything. He was just like, yeah, this will be fine. Then I went to another one, and they were very adamant on staying really small and low profile.
Okay.
And I was like, well, that's definitely not what I want to do. And then the third person told me that I might potentially need a lift. The second one also said that that was a potential, but the third one was more on that page that I would need a lift, but he was so unsure that he told me he would size me and determine if I needed a lift while I was under anesthesia.
Really? So he was basically going to cut you up and do a lift without you really knowing you were going to need that?
Yes. And picking the size also would have been under anesthesia. And that just made me really feel uncomfortable that I, one, didn't have a say in it. And then also the fear of like capsule contracture and introducing more bacteria that didn't need to be there.
I can't believe somebody contemporary who does breast augmentation would ever say that.
I know. It was kind of crazy. The person I know that referred me there is already looking to get them redone. So I'm really glad I didn't go there.
Did you have a complication with them?
They're just really far apart. Yeah.
No cleavage.
No cleavage, yeah.
I've never met a patient who's told me, don't give me cleavage.
Right? No. No. That's what you go for.
Exactly. And then you ended up coming to me.
Yes.
And I think I was the only doctor you met who does gummy bear implants. Is that right? Or did the other guys?
I think the other ones did also, but none of them had suggested the anatomical. And they were all suggesting different profiles, and just, it was just all over the place.
Yeah. And when you came for the consult, we talked about doing those anatomical gummies.
Yes.
And we talked about going under the muscle.
Yes.
And there's different kinds of implants. There's saline, regular silicone, and gummy bear. There's different kinds of gummies. There's round, and then there's shaped. For you, I recommended anatomical or teardrop-shaped implants. And the reason I recommended those was because we wanted to create a lifted appearance without causing all the lifts and scarring, all the scarring from a lift. And the lift scar is around the nipple, down on the side. It's that anchor incision. Whereas when I can just do an implant, I can make a small, approximately 5 centimeter incision along the breast fold.
Yes.
And that's what you wanted. You didn't want all those lift scars, right?
Yes. At least not right now. If down the road it was necessity, we would have reached it at that point.
And then we looked at sizing, and I remember you told me you wanted a full size.
Yes.
So we looked at different implants together, and I measured you. We looked at sizing, and we went with 620 cc's.
Yes.
Why did you want to go that big?
I don't know. I just did. All the pictures on Instagram, all the people that I was looking at, they were all larger, busted, and I felt like it fit my body.
Got it.
Which I still do think it fits.
Yeah, absolutely. And when you pick implants, it's so hard because there's no right answer. There's no equation. And that's one of the reasons you got so many different answers from different doctors. I wouldn't sit here and tell you any of those doctors are wrong. What I would say is everybody has their own way of doing it. And the best way that works for that doctor consistently is what they'll keep recommending. And the good thing about 2020 or 2019, 2018 is you as a patient now can do research and you can meet different people and figure out who's the best fit for you. Because back in the day, in the phone book days, you had about 2 or 3 options, right? Yeah. Now you got about 60 in Seattle.
Well, and I just felt like I wanted to go with a person that seemed confident in their answer, even if it was telling me no to something. Nobody was telling me no or yes or this is what I could do until I met with you. You were like, this is what I can do, and I'm confident in that. And I was like, okay, I get that, especially from a hairstylist standpoint. I tell people that all day long. This is what I can do. So
what about the consult made you comfortable with me?
You were just very straightforward and honest, I felt, and you didn't overpromise or underpromise. It was just, this is the facts and this is what I can do. And that is what I appreciated.
Thank you. And when I remember when we saw your anatomy and I reviewed your case, certainly before this, because it was 2 years ago, one of the concerns I had was there was a little bit of ptosis or sagging, right? That normally happens with pregnancy. So I recommended the anatomical to give you that lifted look. The other reason I liked that implant for you was I could go big while also decreasing risks. Now, one of the reasons some doctors don't want to go big is because they're harder to do. When you go big, there's a higher risk of the implants falling too low, settling too high, getting an infection, and losing an implant. The advantage with my technique and the gummies that I use is I can minimize those risks to very low. They're still there while giving you a shape that's perky and full.
Yes.
So then we went with the 620s under the muscle. And now implants can be placed 2 places, above and below. You did some research on that before, and we decided below. Now, the reason we decided below the muscle was because there's less risk of capsular contracture. They sag less. I feel they give a much more natural look, and you get that gentle slope that falls on the breast. Then you decided to have surgery based on our consult. And then surgery day came. How were you feeling?
I was always a little nervous about anesthesia. That was kind of the reason why I waited so long. And just talking to people, they're like, you can get in your car and you have more risk like getting in a car crash. I was like, okay, I wanted this for at least 20 years. Like, it's okay. Okay, it's fine. Like, that was the only thing that I was really fearful of. Did you have a partner or someone in your life at this time? I did, yeah. Okay. And what was the relation to that person? He was my fiance at the time. And do you mind if I ask you a couple questions about that? Sure. How did he feel about you getting implants? He was actually, at the time, not in favor necessarily. Like, he wasn't opposed or in favor. He was just kind of like, it's up to you. But in his mind, he didn't prefer implants. Why do you say that? He just didn't like the fake look. He likes natural feel and boobs. Did he tell you any other reason why he wasn't supportive of it, or as supportive, like, or ecstatic about it or excited about it? No, not really. He was kind of like, just, he's always been that person that was like, whatever you want to do. Like, and I'm the type of person that nobody's going to tell me what to do. Yes, so. Absolutely. Yeah. So was he happy to take care of you after surgery and take you to surgery and all that kind of stuff? Yeah, he did all that. And then he took care of my son too during that time. Surgery day came. We did the surgery. Took about an hour-ish to do. You had recovery. Went really well. After surgery, how was the pain? Initially, it was different than I thought it was going to be. I didn't realize how much my arms were going to be affected, but it wasn't too bad. And then the morning boob, I didn't really know about that. Tell us what morning boob is. It's like you wake up and they're so stingy, and sleeping on my side, because I'm a side sleeper, I think is what made it worse. So I ended up pillowing in between and underneath, and that seemed to help some. But it was such a weird sensation. When you came to your first post-op and we looked at them in the mirror, what did you think? Did you regret it, or were you like, oh, it's okay? Or no, initially I thought they were too small. Really? Yeah. But then everything settled and they're definitely not too small. But at the time I was like, they could be bigger. Why did you feel they were too small? What about it? You didn't feel it? Did you think it fit, or what, was there something specific? I think just because everything was so tight at the time, and there was like no like they weren't. I don't know how to explain it. There was no crease or anything. It was just sitting on top. They just didn't seem big enough. And when I size people for breast augmentation, there's multiple formulas. Some people believe you just measure the patient and go by what the book says. Mm-hmm. And if I would have done that, I wouldn't have done more than 400 cc's in you. And I would have got you through the operation, but I guarantee you would have been miserable. And you would have been back for a revision. I found the best way for me to gauge happiness or satisfaction after surgery is to measure the chest and then measure the implants on the chest with you with the bra and determine what look you like. And what you like the most with the bra, I found statistically, is the highest predictor of your happiness. So then over the next few months, the implants settled and you got a more natural look as they dropped. Is that right? Yeah, definitely. And what do you think about the size now? Now I think they're good. I think if any bigger, I would really struggle finding like bras that fit because that's already a struggle. But
And
yeah.
your fiance, at the time,
Yeah.
is he still involved?
We're friends.
Okay, got it. How did he respond to your recovery and you having a larger chest?
Well, then he loved them. He thought that they were like the best he's ever seen. So
after surgery?
Yeah. Yeah. He was like, okay, these aren't bad implants.
And then what happened?
What do you mean?
Oh, do you mind sharing with us why you guys are friends now? Or
well, that was just, we were supposed to get married and then we didn't. And so now we're friendly.
Do you want to tell?
I don't really know the whole answers to that.
Okay. Well, was it one of your decisions or you guys both sort of reached to that conclusion?
It was his decision. Yeah. And then I did not want that. So he has to go, he's doing his own thing.
After surgery, did you notice that you were getting more attention by men or women?
Not really. I feel like when I'm out like at work and stuff, I'm pretty modest in what I wear because I don't want attention from people, especially working so closely to people's faces and stuff. I didn't want that to be, especially managing, I didn't want to draw attention in that way. And I honestly didn't tell my family for a few months after, and nobody noticed.
No one noticed?
No, because I think just because I kept them hidden. Now they notice because I wear V-necks and things, but it took a while for me to get comfortable being open with it.
Do you remember who was the first person that noticed?
I think I don't remember if anybody noticed or I eventually just told them. I know on Christmas, I think it was Christmas when everyone found out because I was, I think, showing my cousin. And then she was drinking wine on Christmas and told the entire family. So then they took turns looking.
Did people make any comments that weren't nice about it?
No, not really. I think everyone was like way more positive than I expected them to be.
Were you the first person in your family to have implants placed?
Yeah, because they're all big. If anything, they're going to go backwards. And I still never told my dad.
He doesn't know yet?
I mean, he might, but he's never going to ask me.
Yeah.
I'm like, that's not a conversation we need to have.
And so our listeners know, you work as a hairstylist, right?
Yes.
And you got 620s, which are, larger implants that, the average person with me gets around 400-ish. Did you feel that your neck and back hurt at all from that as working?
I mean, my neck and back already hurt from working. So I really don't feel like it's increased at all since having them.
Do they get in the way when you're cutting closely or by someone's face or not too much?
No, not too much.
Since then, you said now you're wearing a little bit more fitted clothes.
Yes.
Do you think people notice more now?
I mean, they might. They just don't say anything. I know I've had comments on pictures on Instagram because Instagram's like my more like open social media. And I've had people private message me asking me if I've had them done. But
is it like men or women or both?
Usually girls, yeah, women. And they have had them done. Typically, they have had them done also if they're asking.
Yeah, why do they ask you that?
I don't know.
Do you tell them the truth?
Yeah. I'm like such an open book with things like that. It doesn't really bother me to keep other than my dad.
A lot of patients will often ask me, how am I going to feel after surgery? Months out, years out. Now you're almost 2 years out. How do you feel now? Do you feel more confident?
Yes, definitely.
In what way?
I just feel like it makes my body make sense now. Like all fits together better. Instead of being like a pear, it's an hourglass, which is what every woman wants to look like.
When you think back about having the experience and having the surgery done, is there something you think you would do differently?
I don't think so. Maybe sooner, but otherwise, no.
Have you had to change the kinds of clothes you buy?
A little bit. Like I mean, because I was a lot smaller before. So like fitted tops or peplum tops, things that really like flare out under looks crazy. because it's just like big and then big. So like skirted shirts are not as cute, but I actually wear more fitted things than I did before because I feel thinner, which is cool.
Yeah. Did anyone in your life respond not positively about this?
I don't think so. Like even my grandma was like, good for you. Like they're also supportive.
That's awesome. That makes it a lot easier.
Yeah.
Especially with the recovery. A lot of studies have been done looking at how people heal. And people that have positivity in their life with their whatever procedure they get, they heal much better. And you healed with no complications and went very, very smooth. Aside from having standard pain and discomfort that many women have. Now, in your life since then, since you know your fiance is your friend now, have you had other relationships with people?
No.
Still seeing what's out there.
Yeah. Just hanging out.
Yeah, of course. Why not?
Yeah.
What would you, if someone was thinking about getting an augmentation done, what would you tell them now that in hindsight, looking at this experience you've had?
I have this conversation a lot with people, and I've actually had a friend say that I'm her plastic surgery concierge because and obviously I always refer them to you, but I still suggest them go meet with other people because I feel like that made it so much more sure in my decision to go with you. Like my friend that's getting them done next week, she only met with one, and that kind of freaks me out a bit because she's just so impulsive. But everybody's different, and that's her. And so I definitely would say meet with people and be sure in your decision. And I think that everything I did, I would still do now.
With the recovery, anything you wish you would have had or done differently with that part of it?
I maybe would have bought a pillow, the like chair pillow for my bed, instead of just having a bunch of little pillows. That was like really the only thing. I went on vacation 2 weeks after to Vegas, and it was all fine. Like,
do you think?
Was good.
Yeah. Do you think having had one procedure done makes you likely to have more done now?
I don't know if it makes me more likely. If there was something that I wanted that I could afford, I might. But at this particular moment, as far as like surgical procedures, there's nothing that I really feel that I need.
And one thing you talked to me about was being worried about the anesthesia. And when I do these surgeries, you can do them really 3 different ways. What I do is general anesthesia, which I feel is the safest. So we have you totally asleep with the breathing tube in your mouth. And that way, you know, we can do the surgery safely without you moving or interacting. The other way of doing it is pure local. Some doctors do that. There's one doctor in this area who does that. And
I looked into him.
Yes. And the middle way is doing something called Twilight, where they have an IV, no breathing tube, and they're putting the implants in. I've seen it done all 3 ways. The reason I do it with general is because when you do it under local, it hurts, and the patients usually end up screaming. And it's very hard to go under the muscle. Have you ever heard stories about that?
Yeah, because I initially didn't want to do anesthesia, and I was like, oh, I've had a kid. I have a high pain tolerance. It's fine. I don't need that. And then I researched more into why you need anesthesia, and I was like, okay, fine.
Yeah.
And like I've also heard that going under the muscle without the anesthesia it won't relax totally.
Exactly. It becomes very hard to create the pocket or the space where the implant sits. So local for me was like a no-go. Twilight is another way. With Twilight, it's sort of like wisdom teeth anesthesia, where they give you an IV and they give you usually propofol or that white stuff Michael Jackson died of. But so
Prince, right?
Yeah. The problem with that is even though somebody's like half asleep, when you're I've seen someone do this. Someone in town does that way too. What happens is the patient is moving a lot. And so you're trying to put an implant in a very risky space, which is right above the lungs, below the pec muscle. And if that patient's moving and you're cauterizing, there's a risk you can get into the lung cavity. So that's why I don't do it. So I did it with general. And that's what, you were scared about that. What were you worried about the general anesthesia?
I don't know, just not waking up. Being a mom, having a son to take care of, like just a little bit of me had a little, mom guilt of I'm risking this for vanity, which I was like, is it worth it or not? But then obviously I chose it was worth it because of the chances being so, like the risk being so small.
And a lot of people tell me that, oh, I think I'm being vain by doing this.
Yeah.
Do you think I'm being vain? What would you tell women who are thinking that?
I think that your happiness makes you a better mom and a friend and family member. And so if it makes you happy, then do it, because I definitely feel like more myself, and then me and my son can be closer that way. Even though, like, obviously he doesn't care if I have boobs or not. He's 11. Like, if he finds out I have them, he's probably going to be mortified. But, but I don't think it makes you a bad mom or a person for doing it now.
I think, for example, if someone's going to get a filling done, or they lost a tooth and they're getting an implant in, that is a procedure now that's safe that people do all the time. And I think with breast augmentation, and I know some people aren't going to like me saying this, but with breast augmentation, for a woman who's had some deflation after pregnancy or doesn't feel she has a proportionate shape, I don't think it's that different from getting an implant versus maybe getting like a dental implant in, or a small procedure, because we have it so safe now.
Yeah, and it's your confidence that you're walking around with, so you're not going to walk around without a tooth.
Exactly. You can live without a tooth, but it's not going to. Life isn't going to be as good, right?
Yeah.
Yeah, exactly. I think the same thing, and I think many people don't realize this, that when we're doing these surgeries, people sometimes classify them and categorize them as vain, as unnecessary, as, borderline medicine, but they don't know how transformative it is for somebody. It's a 1-hour surgery, relatively safe, relatively low risk, but it totally changes someone's life. Aside from feeling more confidence, is there anything else that you feel differently about now?
I mean, my outlook on the whole surgery is different. And so when I'm talking to other people and when they're going into it, it's different. Like my friend who's doing it next week, she was so scared of what people would think and didn't want her family to know. And I didn't tell my family either. But then being able to share my experience and outlook on things, she did end up telling her, and everybody's positive. So just having like a more positive outlook on just people, like trusting the people in your life more, is different. And my confidence is different.
Why didn't you tell your family initially? Are they more conservative?
No, they're not conservative. I was more concerned about them knowing about the money, because, I'm still the kid, even though I'm 33 years old. In their mind, it's like, oh, you're the child. You shouldn't be spending money on this, X, Y, and Z, whatever. They're just nosy, kind of.
They would have been. They might have been a little bit judgy.
Yeah,
and
not on the actual surgery, just more choosing to spend money that way.
So when you came to me and talking about the cost, and I never asked you this, but was my cost more or less or same as other people?
I think they were all relatively the same, other than when the one who said I might need the lift, and that price varied and I wouldn't know how much I was spending. Yeah,
I don't know how you can sign up for something like that.
I don't know either. Yeah, no.
And that's a really good point I want to talk about just for a moment. The question becomes, when do you decide if someone needs a lift? So a lift is needed if the gland and nipple is very low on the chest. And for me, it's a very black and white answer, almost always. There are some exceptions to every rule. You get in trouble in life where you try to live black and white. But usually it's very easy to know. And the way you know is if the gland and nipple are typically below the breast fold, then not doing a lift is going to give you a deformity. But if they're above the fold or at the fold, then you have a way of doing it, usually, not always, without a lift. People who sometimes are really unsure or unconfident, I find, not always, they don't have enough experience and they haven't seen and done enough where they can make that call. When you've seen and done hundreds or thousands or tens of thousands, like you do, like hair, you know what color you can give someone. You know what style you can usually cut for someone if you've done enough of it. Wouldn't you say?
Yes, absolutely.
Now, if you're a noob, you've done 5 or 10, then of course you're going to teeter-totter and you're going to build in every single exception you can to protect yourself so you can work around whatever's needed. And I think that's something patients really have to be cognizant of. How do you decide if someone has experience or knows what they're talking about? And the consult is what tells you that. And sometimes you don't know what's there unless you've experienced a few. And when I have patients, I'll often tell them, get 3 consults and then figure out what's the best fit for you. And when I say that, almost always they end up coming to me for various reasons. But having that experience helps you understand what you have or don't have. Because sometimes you don't know if that experience is good or bad unless you know what else is out there.
Yeah, there was no way other than just this like inner feeling of going, it's not quite right. There was nothing, it wasn't like, I don't know what I'm doing. I'm not a surgeon, but it just, until the comparison, I was honestly waiting for somebody to agree with each other to choose, because I was like, okay, well, if I get 2 people who agree on what to do, then that's the right thing to do. But not one said the same thing. It was just then meeting you with the confidence, and it was definitely more black and white. Like, this is, and that's what I needed.
Yeah, and the reason I felt that way is because I had done many cases similar to yours. So I knew, okay, now every person is different, every body is unique, but having treated a similar body type and physique, I knew the most likely path that we were going to go in. And that's what gave me the confidence to tell you, Chandra, I feel I can do this. This is what we're going to get. There's some risk of this. If this happens, we'll do this. If it doesn't happen, we're great. And that's what it's going to be. And either we can do it or we cannot. And that's sort of my philosophy, right? I give you all the information and we figure out what's the right path to go down.
Yeah. And looking back, if I were to have gone to somebody else with round implants without a lift, I would have ended up with like a Snoopy nose. And that would have been awful. Exactly.
And one of the ways I prevented that Snoopiness, and for a lot of women, and this will, I think, help them, is if you're borderline like you were, if the nipple and gland is at the fold and you have borderline ptosis or sagging, sometimes in that case, if you use a specific type of implant that can project or push that nipple out, and you can put it a little bit lower to push it up, you can give somebody a lift appearance by avoiding that. Now, if you've never done that before and you go to a doc who all they know how to do is put an implant in or do a lift, they're not going to be able to give you that nuanced operation. The operation, someone who doesn't know that, what they're going to do is put an implant in, lift the nipple. Or put an implant in if it's not saggy. But that borderline patient is the one that's hardest to manage. And a lot of women are in that position.
Yeah.
Sure. Your friend who's having surgery, is hers an implant with the lift or just an implant?
So hers, she might need a lift on one side, but he doesn't do them at the same time.
Oh, really?
So she's doing over the muscle, which I haven't met any of my friends that have done that, but he's hoping with doing different implant sizes that it will correct the difference. And then if not, then she'll go back.
So above versus below the muscle. So we talked about some of the advantages of going below. Now, a lot of doctors, some of them do believe above the muscle is a technique. Now, it's not my favorite technique for these reasons. Number one, when you go above the muscle, depending on who you ask, there's up to a greater than 20% chance of getting a capsular contracture. A capsular contracture is when you get hardening over the implant. If you remember, we talked about that. We really don't know exactly why that hardening happens. Whenever you put an implant in the body, you get a capsule or shell that grows around the implant. So that shell needs to be nice and soft. For some reason, and I'll tell you the prominent theories, in some women, that shell becomes really hard and really firm. And when you go above the muscle, it's much more likely than when you go below the muscle, usually. We think there's usually 2 reasons that can happen. One reason is bacteria can get on the implant and it causes an inflammatory response and you get that hard capsule. The reason we think that is in women who've had contractures, they've cultured the capsule in the lab and they've grown bacteria. So going above the muscle exposes the implant oftentimes to the mammary or breast tissue and there's ducts and all that in there. And we think there's bacteria that can seed the implant.
Okay.
Does that make sense?
Yeah.
So that's why. The other reason is for some reason, some women just reject the implants. So in that case, that's what it is. The other reason it's not my preferred option is I think what I've seen, and I think many people will agree, is when you go above the muscle, the sagging is much more faster and much more aggressive because there's no support. What does skin do? All skin in life sags. So going below the muscle gives you that internal bra, if you will, that holds it up. The other reason it's not my favorite technique is above the muscle, you'll see rippling almost always. because there's not much covered. I don't know if your friend has a lot of breast tissue or not, but
No, she's super thin.
yeah. So in my experience, I've seen that uncomfortable rippling that can happen, especially when someone bends forward. You'll see lines right over here, around the side of the breast. Good. Any other insight you want to share with anyone, Chandra, about who's thinking about having surgery or their experience that you would tell them? The one most important thing you think.
I feel like probably the consults is the most important, and research and being open-minded, but also knowing what you want.
Exactly. And I think sometimes you do have to take no for an answer, but don't take no without doing some research and having some consults. And that really, really helps a lot of people. So Chandra, thank you so much for being our guest today. I've learned a lot from you and your experience, and I hope your ordeal teaches our listeners how and what to expect when they are on their own cosmetic surgery journey. I appreciate you, your story, and having you as a patient that we've had the privilege of getting to know over the years. Thanks for listening to the Plastic Surgeon Podcast, and tune in next week for my guest who has an amazing story. We look forward to hearing from you next week, and catch us on all social media at realdrseattle. Bam, what?